So most of the coders feel IVR coding is very difficult. Okay, but based on me, IVR coding is not that much difficult as we think. Okay, so in order to get IVR coding easy, we need to understand the basics. Okay, so first I would like to tell you what is IVR. So anyone knows, guys, what is IVR? Anyone? So IVR or IR, usually we'll call it as interventional radiology or IVR or IR, all are same. Okay, is a surgical specialty where physician will use imaging guidance along with the procedure. Okay, so if you observe any IVR procedure, must and should patient needs to use the imaging guidance along with surgical procedure. So that is IVR, intervention plus radiology. Simple. Intervention plus radiology is called as IVR. So first I would like to tell about me. So I am a AAPC certified medical coder. I have nearly greater than 10 years experience in medical coding, and I am the creator of FastCoder 21 YouTube channel. And also currently I will provide complete surgery training. Okay. Today we will see how does the patient will perform IVR procedure basically. So if you understand this one, so you will code any chart easy. So IVR access and procedure, the complete journey. So what is the starting point and what is the ending point basically. So in order to start the procedure, patient will insert the needle. Okay, so this is the introducer needle. Okay, so after inserting the needle, patient will pass the guide wire. Okay, so this is the guide wire. So which guide wire creates pathway to the catheter. So this is the second step. In the third step, patient will use the dilator. Okay, so which will enlarge the pathway. So guide wire is shows the pathway. Dilator is enlarge this pathway. Okay, so next we have sheath. So the purpose of sheath is to provide the access. Okay, so afterwards, after the sheath, patient will place the catheter. So using the catheter, patient will perform diagnostic procedure as well as therapeutic procedure. Okay, so in the sixth step, patient will perform the or eradicate the patient's condition. Okay, so using the contrast, patient will take the imaging guidance assistance and he will perform the procedure. Okay, so these are the 6 steps while patient wants to perform this IVR procedure. Okay, so that is the common step-by-step process for IVR procedure. So needle, guide wire, dilator, sheath, catheter and procedure. So why means these are very important. Why means in the each and every IVR surgery report you will see these words. If you know meaning of these words, you can understand the operative report in easy way. So that's why I started with this one. Okay. So next we have in our training, you will learn first class will be IVR important definitions. Okay. So what are those definitions? Like angioplasty. Okay. Angioplasty, stent placement, atherectomy, thrombectomy, lithotripsy. So all these procedures we will learn first. Okay. So what is selective catheterization? What is non-selective catheterization? What is antegrade? What is retrograde? Okay. So all those things you will learn in the first lesson. Next you will learn appendix L. Usually we will call it as like what do you call? IVR family. Okay. Or vascular family. So if you understand vascular family, you can code any chart 90%. Okay. So after definitions, you will learn appendix L, where you will learn how to read the vascular family. Okay. Next, you will learn vascular access. Okay. Most of the time, fish will use only one access for the procedure. But sometimes fish will use multiple access. So how to code that situation? Next, you will learn diagnostic angiography. Okay. So angiography is the very important keyword in the IVR procedure. Okay. So as the name itself indicates, here physician will identify the root cause of the patient's condition. I mean, this is diagnostic. Okay. Next, we will learn therapeutic interventions. Okay. Like as we discussed previously, what is angioplasty, what is stent placement, what is atherectomy, what is thrombectomy, and also what is lithotripsy. These are the common procedures you will encounter in the IVR coding. Okay. Next, you will learn what is the difference between vascular and non-vascular procedures. Okay. So that we will learn soon. Next, you will learn how to check the imaging guidance. So what are the common imaging guidance for IVR coding? Okay. Next, you will learn how to use the appropriate modifier along with IVR procedure. And also along with this, we will see few practical scenarios. Most of the time in the IVR coding, you will learn only practical. So theory is very less in IVR coding. In other specialties other than IVR coding, like integumentary, digestive, like that, you will learn most of the time theory. But in your IVR coding, most of the time you need to learn the practical. So along with guidelines, we will learn practical scenarios also. This is our complete IVR training criteria. Okay. So first core difference, vascular IVR versus non-vascular IVR. Okay. In vascular IVR, target is arteries and veins. Non-vascular IVR, organs, tissue, joints, ducts, cavities and lesions. Most of the time, in non-vascular IVR, patient will perform biopsies, fine needle aspirations on tissues or joints. Next, access. For IVR procedures or vascular IVR procedure, patient will use artery or vein as the access point. Okay. Whereas in non-vascular IVR, patient will use percutaneous needle or catheter or natural tract. Okay. So in vascular IVR, we need to concentrate on vessels, whether it is artery or vein, vascular family, as well as catheter position, as well as intervention, like whether it is angioplasty, stent, thrombectomy, lithotripsy, or atherectomy. Okay. Whereas in non-vascular IVR, we need to concentrate on anatomic site, procedure, approach, imaging guidance. Okay. Most common examples of vascular IVR procedures are angioplasty, stent, embolization, thrombectomy, and dialysis access. Okay. For non-vascular IVR, biopsy, drainage, ablation, nephrostomy, biliary drainage, as well as joint procedure. Okay. You will learn all these things. In the training, you will learn vascular IVR as well as non-vascular IVR also. These are the most common procedures you will encounter in the vascular, and these are on the non-vascular IVR. Okay. Whenever you code vascular IVR, you need to check for access first, as we have discussed previously. Next, catheterization, vessel, imaging or intervention. Okay. Whereas in non-vascular IVR, you need to check the access first. Access or site basically. So target, needle or catheter, procedure or guidance. Okay. Most of the IVR procedures are included, imaging guidance is included. Okay. Non-vascular IVR procedure, we need to use the imaging guidance. So that I will learn during our training. Okay. So these are the major CPT families for vascular IVR. In our training, we will learn all these vascular families. Okay. Mostly dialysis access is very important. Dialysis circuit access is very important. Okay. Next, also angioplasty, thrombectomy, and IVUS. And most importantly, you will learn 2026 lower extremity revascularization. This is very important. Regularly you will encounter. Okay. Next we will learn venous procedures. Okay. So in IVR, vascular IVR, we have common procedures on arteries as well as veins, but little bit coding guideline change. Okay. So that we will learn during our training. Okay. Next, as we have discussed previously, you will learn all vascular diagnostic imaging. So how to identify orthography, how to identify extremity angiography, all those things. When to code venography and when not to code venography. What is selected venography. Okay. So these are all things. So these are very important. Lower extremity revascularization. So which includes angioplasty, stent, atherectomy and combinations as well as lithotripsy. These are very important. Live coding, you will encounter these things. Okay. So these are the non-vascular IVR major families. So previously we have seen these are the vascular families. Okay. So these are non-vascular families. So we will learn all these codes. Okay. Fine needle, soft tissue aspiration, breast biopsy. We will learn all these procedures during our live training. Okay. Next, you will learn how to code prostate procedures. Okay. So how to code fiducial marker placements. All things you will learn during our live training. So next we have central venous access. Okay. So these are also very important. Here you will learn how to identify tunnel versus non-tunnel procedures. Okay. So how to code Porte catheter, insertion, replacement as well as removal. So what is the difference between CVC and PICC line? Okay. All those things you will learn here in the central venous access procedures. Okay. Next, these are very important. Dialysis circuits. Okay. So how to code dialysis circuit procedures. So these all procedures you will learn. These are dialysis circuit. This is very important for surgery coders. Okay. So how to code here also same. How to code angioplasty, how to code thrombectomy. Okay. So how to identify peripheral dialysis segment as well as central dialysis segment. Okay. How to code embolization. Basically, what is the purpose of embolization? All these things you will learn during our live training. Okay. Next, these are the imaging guidance. Okay. So these imaging guidance we will learn. You will learn. This is very important. 76937. When do you need to code 76937 separately? Okay. So when do you code and when not to code 76937? So all those things you will learn during our live training. So whenever you want to code vascular coding, these are the checklist. Whenever you want to code first, you need to identify whether it is arterial or venous, or otherwise artery or vein, where physician is performing the procedure, artery or vein. Next, you need to check for access site and catheter position, whether physician is inserting the catheter in the leg area or arm area, and where is the catheter stopped. So why means based on catheter position, we have selective and non-selective catheterization. So that is the reason catheter position is very important. Okay. So next we have diagnostic angiography or venography. Okay. So here you will learn when to code angiography and venography separately along with the therapeutic procedure. Okay. And you need to understand how to identify the keywords in the operative reports, like how to identify angioplasty, how to identify stent. So what is the difference between atherectomy and thrombectomy? So how to identify basically? What is thrombolysis? What is embolization? Okay. All these things you will learn. Next, as we have discussed previously, you will learn 2026 lower extremity revascularization, how to identify territory and lesion complexity. So basically we have straightforward lesion and complex lesion. Okay. How to code this procedure and how to identify in the operative report. So all these things you can learn. So next you need to check whether physician is performing therapeutic procedure on any additional vessel or territory. Then how to code. Okay. Next, we need to check bundling, parenthetical instructions, and NCC edits based on the payer policy. Okay. So all these things we will learn during our training. Okay. So these are the for vascular coding checklist. Now we will learn afterwards non-vascular coding checklist. Okay. Whenever you want to code non-vascular IVR procedure, you need to check the target organ. Okay. Next, tissue. Next, cavity, duct, joint or lesion. You don't need to worry. We will learn all these things. Next, we need to identify the exact procedure. What physician is performing. Whether it is performing biopsy, aspiration, drainage, ablation, injection or catheter placement. Okay. Next, we need to identify the approach. Whether it is open, laparoscopic. And also we need to check imaging guidance. Why means, as we have discussed previously, all non-vascular procedures mostly have two codes we need to use. Only vascular procedures, sometimes imaging guidance is included. For non-vascular IVR procedure, we need to code the imaging guidance separately. That we need to check, and I will teach you how to identify whether you need to code imaging guidance code or not. Okay. Next, you need to understand, will you code imaging guidance separately or not? That we will learn. Okay. So just here, next we need to understand what physician is doing exactly. Whether he is placing the catheter, exchanging the catheter or removing the catheter. Okay. So if the patient perform multiple procedure, we need to check the NCC edits. So and also we need to verify the documentation to support the exact CPT descriptor. So basically, you don't need to worry. I will teach you. So how to do all those procedures. Okay. So these are the things you will learn during our live coding. Okay. If you understand vascular family. So vascular family is the very essential and important concept in IVR coding. So first you need to understand how to identify the vascular families. How to identify first order, second order, third order. Okay. There only you need to learn how to select selective and non-selective catheterization. So those things, everything I will show you through practically using the images. Lower extremity vascularization, 100% important for live coding. So dialysis circuit interventions, 100% important. Prostate procedures, 100% important. Okay. Wherever we have important concepts, we will spend more time on them. Okay. Yeah, you can learn. Why means how to code cerebral aneurysm. So most of the time, physician will perform embolization for cerebral aneurysms. So how to code those procedures? We will learn during our training. WhatsApp message to this number 707-526-3939. Whatever mentioned here. So everything you are going to learn. Okay. So whatever mentioned here, everything you will learn.